Hi, this is Dr. Phil Smith again for part 7 of solving the MedRec problem, deconstructing medication reconciliation. And today I'm going to talk about the single source of truth impact that we could be having with medication reconciliation if we tackle this problem differently than how we're doing it today. Again, I include a slide about me for those who have not heard me before. So let's talk about why we need to tackle this and the cost of and the risk of doing nothing. I've calculated that if you look at medication reconciliation opportunities, and medication reconciliation should occur anytime a patient and a provider kind of switch venues. So this is when the patient comes in to the hospital and get admitted to the hospital. We have to reconcile the medications, or if they move from the intensive care unit to the regular hospital ward, or if they go home from the hospital, or if they go to a nursing home or leave a nursing home, or if home health gets involved or they leave home health, or the patient comes to the emergency room or to a doctor's office. And if new medications are prescribed, then we need to reconcile again to update the medication list. So I've calculated on the low side, we're talking at least 1.1 billion medication reconciliation opportunities each year. And that consumes over 64 million person hours of physician, pharmacist, and nurse time. So that's such an unbelievable number of hours that I divided that by 2,000 hours per year, and that comes up to 32,000 full-time equivalents. And if you multiply that by just a typical blended rate of physician, pharmacist, nurse time, it's well over $3.8 billion a year in costs to do medication reconciliation. Yet, despite this cost, adverse drug events and medication management errors occur at an alarming rate. They affect over 2 million of our hospital stays each year, prolonging them by an average of anywhere from 1.7 on the low end to 4.6 days. They account for over 3.5 million physician office visits, over 1 million visits to the emergency department, and it's attributed that over 125,000 hospital admissions merely occur because of medication mishaps. So this is a huge cost. And the shame about it is so many people think medication reconciliation is something that we've done and we've moved on. And it's amazing that we have this much cost and not as much benefit as you would expect. So the whole premise of the MedRec book is that medication reconciliation, as done today, is in fact a broken process. And, it goes back to the old analogy, insanity is doing the same thing over and over again, thinking we'll get better results next time. And mainly this is because there are just too many sources of medication lists that have to be reconciled. And I've outlined these in the book and in the prior YouTube presentations about the 30 plus challenges of getting an accurate and true medication list at any one time. We have what the patient tells us they're taking, which actually may not be comprehensive of what the patient is actually taking for the many reasons I've just outlined. What is in the electronic medical record for the multiple people providing care and the multiple organizations providing care, from home health agencies to hospitals, doctors' offices, pharmacies, mail order pharmacies, and on and on and on. And the whole premise is if we could create one continuously updated list of medications and everybody used it, including the patient, the caregivers, this would be family members, parents in the case of children, pharmacies, physicians, and anyone else in the loop, we could eliminate so much of this confusion. And we would be creating what I like to call a single source of truth. And for those of us in informatics, we know that creating a single source of truth is really the solution to a lot of problems that we face in this very complex medication management process. So in the book, MedRec, I provide details on how we could potentially get to a single source of truth for medication histories. This would likely require a public-private partnership with buy-in by Americans so that they would allow some considerations for privacy and security risk over the risk of harm from the current system. And in part 8, the next YouTube video, I'll discuss some ongoing projects that are worth noting on this topic that are contributing to solving this problem for us and can act as pilots for the future. But before we conclude today, I realize that solving complex problems like medication reconciliation really requires everyone in the industry to start upping their game and questioning, even though we're doing MedRec and some people think mission accomplished, MedRec is passé, well, that's something we do every day and it doesn't need to be fixed. We need to challenge ourselves to look at the things that we've already accepted as the process solved, and if they're really not working, let's figure out how to make them better. And I think MedRec is one of those complex, I call them unsolvable problems in healthcare that we really need to tackle. It's a shame how many people are harmed each year, and I really don't feel that we're doing our job. And with all these new competing priorities like artificial intelligence, machine learning, big data, analytics, and so on, we still need to supplement technology with the skills that people need who actually implement the technology. So I'm not talking about the data scientists and the AI experts, but I'm talking about their leaders and other people in health IT who know healthcare and really want to make a difference and make it better. And we need to create synergy between those subject matter experts like the data scientists and people who have been in health IT and really need to up their game. So I've given this a lot of thought, and after some input from some of my own mentors and some of my mentorsees, I've decided to put together a course which I call the Health IT Personal Accelerator course. It's a 6-week course. You can find out more about it at https://HealthITAccelerator.MedMorph.com, and you can click the link on this YouTube video as well in the description. So I hope you check it out and find out more about the course, and I'm really excited. I've run some people through the course already, and they're getting a huge benefit already. And again, if you have not downloaded the MedRec ebook, it's available free at www.medrecfreedom.com. Thanks for joining me.